Getting started with Prognosis. When you implement Prognosis, you are revolutionizing your clinical and financial workflow for the sake of enhancing your patient's overall experience within your practice. From the personalized single view of the day schedule through customizable encounter screen and face sheet, every user's specific workflow can be based on the type of visit the patient is being treated for. The system includes an auto refresh of the patient's status from the moment the scheduled appointment is arrived throughout the exam up until checkout, so that there is always an immediate understanding of where the patient is throughout the day. There's a seamless health maintenance, immunization tracking, and order management to ensure that your patient's care is top priority. All of this with an integrated communication between the front and back office, clinical staff, and patients. This is done through a series of system alerts and user-defined alerts based on clinical or financial events. With a fully secure patient portal to share vital health information with your patients, Prognosis is certified for meaningful use compliance for all current stages. At the close of a visit, your claims will be auto-generated and integrated into the practice management side for complete activity tracking both at the clearinghouse and payer level. Also available is a full-service medical billing revenue cycle management service. Both clinical and financial information is stored securely with a complete history, transaction log, and audit trail of user and system activity. With Prognosis, you have one of the most robust and complete practice management systems available, no matter what your specialty or specialties. Now, with regards to the clinical side, or the electronic medical record, Prognosis is equally efficient for both single or multiple provider, as well as single or multi-specialty practices. Tailored towards your needs based upon user roles and permissions, each user will have individual accessibility defined for their workload. Clinical staff can have a personalized homepage, which defaults to your preferred filters and schedule. The flexible work pattern is designed to accommodate all types of schedules and provider scenarios. This includes fully credentialed MDs and DOs, mid-level providers, temporary or substitute, ancillary, even for non-human entities that require scheduling can be accommodated. There's a comprehensive patient register which stores pertinent demographics and other details for the patient and their emergency contacts. A robust ordered management system, along with integrated health maintenance protocols that are customizable for your needs and your patient population. Doctor preferred list and user properties provide shortcuts for frequently used codes and functionality. These can be defined at the clinic level or at the provider level. Lists such as your ICDs, frequently used CPTs or HCPCS codes, medications, laboratory and radiology tests, consultations, health maintenance protocols, and so on. There's also a built-in correspondence mechanism for your consulting and referring physicians, along with a complete list of scans, faxes, chart notes, and any other pertinent documents for the patient. All of this wrapped in a fully certified meaningful use compliant package. With Prognosis, you will be amazed at how convenient an electronic health record can actually be. Now, moving into the practice management side, Prognosis PM also accommodates very easily a single provider office or multiple billing groups, and this provides full support for 1500 as well as UB04 claims. Same as on the clinical side, user roles and permissions will determine your individual accessibility so that each user has the appropriate access they need in the system. There's a financial dashboard of all claim and payment activity available on the home page, which is updated in real time. Also, an auto refresh for your claim status and automated posting of electronic remittances. Customized Claim Scrubber allows you to ensure optimum accuracy so that every claim that goes out the door is clean. Direct tracking management of claim activity with support of multiple EDI clearinghouses. Multiple billing scenarios such as employer health, DME, rural health, and other unique situations are cleanly accommodated within Prognosis. We have comprehensive user work lists and follow-up assignments defined based upon your local workflow. You can define patient payment plans, collection agency tracking, which includes automated reimbursement calculation, denial and disputed claims management, archived and real-time data at the provider, payer, patient, case, or claim level. A highly sophisticated custom report writer exists so that you can define every report needed for daily use, trending, or for the overall fiscal health across all levels in the practice. Also available is the Revenue Cycle Management Medical Billing Service. With Prognosis, your financial health is right at your fingertips 24/7. You never have to guess how one fiscal period compares to another or where your money is. Another exciting feature available to you when you implement Prognosis is our mobile applications and portals. These modules are fully compatible with any common day portable tablets, notebooks, and iPhone, wherever you have Wi-Fi connection. This gives you 24/7 access to your patient's electronic health information at your fingertips. 100% secure data using the Amazon state-of-the-art cloud environment. Our mobile apps and portals help you to achieve meaningful use compliance for multiple measures of all stages, such as patient access to their electronic health information available in real time, clinical summary immediately available to patients or their authorized representatives, secure electronic messaging between your patients and yourself. There's also direct access available for your referring and consulting physicians. This provides them access to all relevant clinical and diagnostic details, progress notes, letters, and so on. This, of course, frees up your staff from answering phone calls so that they're able to perform other relevant tasks. Your referring physicians can also be given the ability of registering new patients that they are referring to your practice. And of course, the free app on your iPhone is always available for you to download. With Prognosis, you take full advantage of the most current and exciting technology that makes patient care the most advanced it has ever been across all levels of care. So now we're going to do a brief walkthrough of this amazing solution for your busy practice. I've logged in here as Dr. Cooper, and I am looking at my personalized homepage. Now, the personalization comes at several levels. We have a filters button, which will allow you to choose the provider or providers, the different encounter types, appointment statuses, as well as locations. Whatever filters are chosen will be tied to that login until you change them. You see across the top of the page, I see the clinical staff that is assigned to me during the day. And then I have shortcuts into my preferences library or patient reminders. But as I look at my schedule, I can get a real-time snapshot with a 60-second auto refresh of my day's patients. Who is ready for checkout? Who is being attended already by the doctor, the nurse, or the MA? Who is ready for the nurse, the MA, or the doctor, or the technician, and so on. This ensures that everyone in the office knows exactly where every patient is within their workflow. Now, for today's sake, I'm just going to open up Victor's chart. He's a patient that has been here before, and he's waiting for me, meaning the MA has already done their job. Now, notice how these alerts are automatically popping up in my face. This is just one level of the built-in communication. We quickly see here, he has tested positive for his drug screening. He's the doctor's wife's brother. He's allergic to latex. Just a few examples as to what you can put on these alerts. Now, I've also got a customized encounter screen. I've chosen that for my follow-up patients, I want to see the last visit progress note, so that as I'm going into the bedside, I can immediately refresh my memory as to what was discussed, what my plan of care was, what the assessment was, any labs and radiologies, and so on. Now, I also have the ability of having multiple face sheets. So in addition to the previous visit, I can look at my Coumadin log, for instance, or my vitals history. Or I can go to his default face sheet, which will show me the overview of his medical history, family history, current medications, and so on. If I want to quickly do a refill, for instance, maybe he is visiting today simply to get his refills. If the prescription qualifies, I can simply click the plus RX box so that at the end of the examination, the prescription is written and ready to be given to the patient. Now, let's say Victor also has had some labs, and I want to review the labs with him today. So along my encounter menu, which is also customizable by my workflow preferences, I'm just going to go on in here and look at his results, and I can choose to do that individually by each order or at a history level by looking at a matrix. Now, the matrix allows you flexibility of customizing also at a category level, a test level, and so on. I'm just going to go ahead and look at all of Victor's labs at a test level. And in the matrix form, you'll see that based on his encounter history, I can scroll through and see at a quick glance all of his lab results. And then based on whether they are abnormally high or low, if there are attachments, if I need to go in and actually read the lab result numbers, I can do that at the click of a mouse. Now, if I need to go ahead and do some more ordering on today's visit, when I am on my assessment screen after I have completed my examination and I have chosen to diagnose my patient and put in my plan of care, I can easily down here say what labs I would like to order simply by coming in and selecting them. If I need to add comments, I can. Notice it is automatically part of my plan. And now that I am completed my patient's visit for today, I can quickly come up here and indicate that he is now ready for checkout. And when I go to my home page and I look at Victor's status, it now has changed to the color pink because pink is my color coding for ready for checkout. But notice, unlike Sally Windows where it actually says the word checkout, for Victor it says process L and D. And as I click over there, my tooltip tells me the whole status is ready for checkout, process lab, dispense drugs. That lets my front desk know, one, they're ready to leave because I'm done with them, but before the patient leaves, they need to be given their lab requisition and their prescriptions. Now, in the case of Sally Windows, since she has nothing outstanding, I'm just going to go ahead and check her out and complete the encounter. This is easily done by going to the Encounter Close option from her encounter. This summary would let me know if there is anything else outstanding that I may have missed, and when it's ready, I can simply say Mark Encounter Complete Sign Off. And I have the ability to create the claim. Now, the claim will automatically create in conjunction with closing the encounter, or if I needed to leave the encounter open, I could simply create the claim on demand. Now, the Meaningful Use dashboard, if you are going for meaningful use, will automatically pop up and let me know whether or not this encounter is compliant. So now, if I toggle into the billing side, we will notice here, Sally Windows has a visit status of complete, and her bill status is ready to bill. So now the biller can very quickly go in and work the claim. So you see how easy it was for me to toggle into the billing module simply by clicking the toggle. And now on the billing side, I have an overview of my financial dashboard, what claims are ready to go out, what money has come in and is not posted yet or has been posted, and then key is my outstanding AR.